through COVID, health systems in general lost a whole bunch of money, operated at double-digit negative margins basically all across the country. Now, coming out of COVID, now we're a couple of years removed from really the effects generally of COVID as it relates to healthcare as a business. Most hospitals have gotten back to a point where or health systems, I should say, have gotten back to a point where they're operating at a positive margin, albeit much, much thinner margins than they've operated at historically. You get a lot of hospitals or a lot of health systems that are operating at a margin less than 1%, most under 3% for sure, which is half or less of what it might have been sort of pre-pandemic. And to your point, Tyler, what that means is just there's not a whole lot of money left to invest back into the health system. The capital dollars aren't there. And that said, they really don't have the ability to significantly grow the population that they're taking care of to offset some of the rising costs to doing business. These are, confined structures with finite amount of space and finite resources, finite capacity, and in a bunch of outpatient departments, things like that really just limit the size of the population they can take care of. So they've got to figure out how to navigate margin pressures and try to create some sort of operating margin that allows for investment back into the health system. So it's kind of a long-winded way of getting around to the idea that DME and the ability that DME provides to move patients out of these care settings and into the home without cutting into referral sources, revenue streams, just becoming essentially a cost savings entity by getting patients out of the hospital earlier, or reducing readmissions and helping avoid readmission-related penalties. All those things are a big, big deal to hospitals.